From the director of Bend It Like Beckham.
Merry Christmas.
What do they call you then? Scrooge?
What right have you to be merry? You're Indian and poor.
What right do you have to be grumpy, huh? You're British and rich.
Based on the Dickens classic A Christmas Carol.
Open your heart and listen.
Change yourself.
Party pooper.
For the better.
It's festive, feel-good fun for all the family. Christmas Karma in cinemas November 14th.
So watch the film for sure. और मेरा संगीत.com के आज के चैट इन चाय की पॉडकास्ट पर आपके रूबरू रहेंगे जाने माने यूनाइटेड स्टेट्स के प्रैक्टिसिंग डॉक्टर विकास भतारा। आज हम उनसे बहुत सारी जानकारी लेने वाले हैं अबाउट
Kanwal, today we'll be talking about migraines.
So what are migraines, Dr. Bhatara?
Migraines are kind of headaches that can also involve other symptoms, not only headache, but headache plus some symptoms. Migraine can affect adults and children. They're more common in females than males, and they can start with mild, but they can get worse.
So Dr. Bhatara, do tell us what are the other symptoms besides headache, if there are any, that we should look into for migraines. और क्या symptoms हो सकते हैं?
Beside headache, which gets worse over several hours and usually throbbing, and it only affects like one side of the head. Other symptoms beside the headache of half a head, nausea and sometimes vomiting, sensitivity to lights and noise, lying down in a quiet room can help. A dark room can help. People like to avoid light during the episodes of migraine. Also, there is something called aura. So migraine have this aura. An aura is a symptom or feeling that happens before or during the migraine headache. Each person's aura is different, but most cases the aura affects your vision. You might see flashing lights, bright spots or zigzag lights, or lose a part of your vision, or you might have numbness and tingling in the lips, lower lips and fingers of one hand. Some people hear sounds or have ringing in their ears as a part of their aura. The aura usually lasts few minutes to an hour and then goes away, but most often lasts 15 to 30 minutes. People who get migraine with aura usually cannot take birth control pills, and that's because they might increase the risk of stroke. Many people get their symptoms of migraine that happen several hours or even a day before the headache. Doctor call these premonitory or prodromal symptoms. They might include yawning, feeling depressed, irritability, food craving, constipation or a stiff neck.
आगे शो में हम डॉक्टर भतारा से इसी विषय पर कुछ और बातें करते चलेंगे। रहे आप ट्यून इन हमारे साथ मेरा संगीत.com पर।
जीना मुश्किल इस साल
फिल्म क्रिसमस कर्मा का ये गीत आप सुन रहे थे। ये फिल्म आपके नजदीक के थिएटर्स में, इस फिल्म को आप देखें जरूर। अपने रिव्यूज पहुंचाना चाहें kanwal@merasangeet.com पर बिल्कुल आप पहुंच सकते हैं, लिख के या फिर रिकॉर्ड करके। इस वक्त आपके रूबरू हैं डॉक्टर विकास भतारा, बहुत ही जाने माने डॉक्टर, यूनाइटेड स्टेट्स में बहुत सालों से प्रैक्टिस कर रहे हैं। आज हम उनसे बातें कर रहे हैं माइग्रेन्स के बारे। सो डॉक्टर भतारा, आर देयर एनी काइंड ऑफ टेस्ट दैट वी कैन डू फॉर द माइग्रेन्स?
No, Kanwal, there is no test, but your doctor should be able to tell if you have migraines by doing an exam and learning about your symptoms. It's a clinical diagnosis, basically.
So, Dr. Bhatara, when do you think that we should be seeing a doctor or a nurse?
Yes, if you think you're having migraines, you should talk to your doctor. You should also see a doctor if your migraines get worse or more frequent, and if you have new symptoms.
And so, Dr. Bhatara, is there any way that we can prevent migraines?
Yes, some people find that their migraines are triggered by certain things. If you can avoid some of these things, you can lower your chances of getting migraines. You can also keep a headache diary. In the diary, write down every time you have migraine, what you eat or what you ate and did before it started. The way you can find out if there is anything you should avoid eating or doing. You can also write down what medicines you took, whether or not it helped.
And here, Dr. Bhatara, I want to ask you about the common triggers that we should look out for.
Common triggers for migraines are stress, hormonal changes, skipping meals or not eating enough, changes in the weather, sleeping too much or too little. Both can give you headaches, migraines. Bright or flashing lights, drinking alcohol, certain foods can trigger it. Okay, red wine, aged cheese, hot dogs, you name it. So everybody is individual. If your migraines are frequent or severe, your doctor can suggest other ways to help or prevent them. For example, it might help to learn relaxation techniques, the way to manage stress. There are also medicines that can help.
And now, Dr. Bhatara, the most important question, how is migraine treated?
There are different medicines that can help with migraines. Your doctor can help you find the best treatment for your situation. For mild migraines, you can get over-the-counter medications like acetaminophen or Tylenol or paracetamol and ibuprofen, Advil, Motrin, naproxen, Aleve. Those things can help. There is also medicines that combines all of them, like acetaminophen, aspirin, and caffeine combination. Over-the-counter medication named Excedrin. For more severe headaches, there are prescription medicine that can help. Some such as called triptans. Very good medications help to relieve the pain for migraine attacks. Other prescription medicine can help to make migraine attack happen less often. If you have severe nausea or vomiting with your migraine, there are medicine that can help with that too. Do not try to frequent migraines on your own with non-prescription pain medication. Taking non-prescription medication too often can actually cause more headaches later. So it's a catch-22 situation. If you're getting really frequent migraine headaches, I think over-the-counter medication does not work. Actually, they can make it worse. But mild form of migraines you can treat with over-the-counter. So basically, with a severe migraine, the options are limited with prescription medicines only, and then to prevent them. It's a billion-dollar industry, Kanwal, to control migraine because they are so frequent.
So, Dr. Bhatara, what if a patient of migraine intends to get pregnant? What would be your advice to them?
If you want to get pregnant, talk to your doctor or nurse before you start trying. Some medicines used to treat or prevent migraines are not safe during pregnancy, so you might need to switch medicines before you get pregnant. Some people notice that their migraines actually get better during pregnancy and breastfeeding. This is related to the hormonal changes in the body.
So that was a very informative conversation with Dr. Vikas Bhatara. यूनाइटेड स्टेट्स में बहुत सालों से प्रैक्टिस कर रहे हैं. आज आपके रूबरू रहे. माइग्रेन के बारे हमने उनसे बहुत सारी जानकारी ली. अगर आपके जहन में कोई भी सवाल है इस विषय पर लेके या फिर कोई और हेल्थ इश्यू के बारे में, लिखें जरूर kanwal@merasangeet.com पर. और अब चले चलते चलते आपके लिए कुछ खास है.
From the director of Bend It Like Beckham.
What do they call you then? Scrooge?
What right have you to be merry? You're Indian and poor.
What right do you have to be grumpy, huh? You're British and rich.
Based on the Dickens classic A Christmas Carol.
Open your heart and listen.
Change yourself
Party pooper.
for the better.
It's festive, feel-good fun for all the family. Christmas Karma in cinemas November 14th.
So जरूर देखिएगा फिल्म क्रिसमस कर्मा आपके नजदीक के थिएटर्स में. Have a great day and stay tuned in with us on your favorite podcasts on merasangeet.com.